Democrat in the Senate wants the governor to reconsider more funding for family case managers. He points to numbers showing that the Department of Child Services is 77 case managers short of meeting state caseload requirements. RTV6 State House reporter Katie Hines is live to explain. Katie?
Erica, DCS describes family case managers as the people who are on the front lines to protect our kids. Senate Minority Leader Tim Lannon says that funding needs to be increased to hire more of them. But the governor's proposed budget outlined last week doesn't include any additional funding for more hires. The most recent report to the State Budget Committee shows 18 of Indiana's 19 regions are not in compliance with state-mandated standards, a number that has grown in recent years. Known as the 1217 standard, the state requires family case managers to handle no more than 12 active cases and monitor 17 children at one time. In a meeting with reporters, Senate Minority Leader Tim Lannon says current caseloads can't continue.
The caseworkers are out there doing a hard job. We all understand that. We expect a lot out of them, and so we need to look at things if it's the matter of adequacy of their compensation, their work conditions. But the last thing we need to do is to stretch their workloads.
Lannon estimates 77 more case managers would cost the state between $5 and $6 million. During a presentation last week, the director of the Office of Management and Budget indicated the state will study DCS caseload requirements in depth. DCS will hire a third party to review staffing, turnover, and other factors before publishing a report this spring. Senate Appropriations Committee Chair Luke Kenley agrees with the idea. DCS has been experiencing an upward trend in staff turnover, peaking at more than 20%, a little more than a year ago.
Whether that's due to how difficult the job is or whether it's due to the salary that accompanies the job, they're not sure what all of those answers are, and so they want to solve the problem and have the proper caseload, but they want a little time to get it ready.
And DCS released a statement tonight. It reads in part, "We are constantly working to improve the quality of service we provide to children and families in crisis, as well as the working environment for our staff." And an agency spokesman tells us tonight that that study will take a look to see if those state-mandated caseloads are adequate, are appropriate, and how to kind of look at things moving forward. He tells us that the time frame is to have that all done by the end of the legislative session. Reporting at the State House, Katie Hines, RTV6.